hub in Abu Dhabi in the UAE, and I'm delighted to be joined in conversation today by the Managing Director of the IMF, Kristalina Georgieva, and by Melinda Gates from the Gates Foundation. To both of you, a very, very warm welcome. The crisis that the world faces, prompted by COVID-19, has been costly, with the most vulnerable disproportionately affected. So I want to focus our conversation over the next 45 minutes or so on how we avoid exacerbating and then re-entrenching old and systemic injustices. And I want to look ahead to where we want to end up after this pandemic. I'm sure we would all agree that we want to be safer, better off, healthier and more connected. How we do that is what we will discuss. And you, our live audience, can follow along with us on social media using the hashtag #InclusiveRecovery. Well, first off, the entire world seems to be chasing a vaccine as an elixir of salvation. Kristalina, let's just be very clear here. To what extent does the global economic recovery depend on the discovery of a safe and effective vaccine? And were we not to get one, for example, in the next 6 months, what chance we never see a recovery?
I'm very, very, very happy to be with the two of you. And to get to the answer to your question, we today project for next year, 2021, growth of 5.2%. This year is a very dire year for our economic history. We will be shrinking by 4.4%. The world would end up smaller than it started the year. What we expect for next year is indeed that there will be success, because so many vaccine trials are now in motion. But we are also realistically expecting that it would take time until vaccine becomes available everywhere, and it would be probably all the way until the end of 2022 when the world with vaccines, equipped with vaccines, will have deployed them universally. So our projections are for a recovery while we are coming forward with the vaccine. What would be the difference if we don't have it? It would be a slower recovery. It would be a bumpier road, and the risk of increasing inequalities will go up. We are very keen to emphasize two things for everybody to know. One, after the shock February, March, there has been an incredible deployment of fiscal resources and of monetary policy accommodation. Technical terms to say, a lot of money has been thrown at this problem, putting a floor under the world economy. And that massive injection of liquidity allowed businesses to continue to exist even during the great lockdown, and workers to receive payments. So my first message is, do not withdraw this support prematurely. Until we have a durable exit from the health crisis, we have to continue to support people and the economy. And two, we have learned how to live and function with the pandemic still with us. So we do this, we wear masks, we socially distance, wash our hands, and the result is, even without a vaccine, we can have a restart of the economy, and that has shown especially well in the manufacturing sector. But in services, in tourism, in contact-dependent sectors, the economy is really shrinking. So with vaccines, we will have a more equitable growth in the world, and hopefully we would have a more sustained exit from the crisis around. Without the vaccine, we will be struggling.
So let's assume, Melinda, because we have to assume that we will get a safe and effective vaccine developed in the near future. Who gets it and when presents a moral dilemma, doesn't it, as well as the economic consequences that we will discuss here. Let's start with that moral imperative. Why, Melinda, is the equitable distribution of a vaccine so important?
Well, it's important that we take care of everybody. And we have to look at who's struggling the most and who's going to help us get back on our feet the quickest. I mean, the idea is obviously we want the swiftest recovery we can around the world to reopen the global economy. So you have to start with looking at healthcare workers. 70% of them are women. So around the globe, you need to get vaccine out first to healthcare workers because they're keeping us alive. Secondly, you have to get it out to the most vulnerable populations in country by country. There have been forecasts done that say if you take the first 2 billion doses of vaccines and they only get out to the high-income countries, you're going to get twice as much death. I don't think we want to see twice as much death in the world. And if we're going to have a swifter recovery, you have global cooperation. And we have, luckily, a mechanism for that. It's called the Act A Accelerator. The global leaders came together in an unprecedented amount of time. When this broke out in early March, by late April, we had this Act A Accelerator. And what we're seeing is that, yes, the high-income countries can put a lot of money into vaccines, but they're going to spend $1.3 trillion in a bidding war on vaccines unless they go through this Act A Accelerator. There's an arm of it that works on vaccines. And if they go through that global cooperation, they'll bring down the price by 13 times. They will spend $110 billion to save trillions of dollars to get our economies regrowing, which will grow the whole world economy again. It just makes sense economically as well.
Why is, I mean, you were just talking about women, and it's important to point out here that women are disproportionately affected by COVID-19. Kristalina, why?
Women are disproportionately affected for many reasons. The first one, as Melinda pointed out, they are on the front line. They are the people in the contact-dependent sectors. Not only they are our health workers, 70% of them, but they are the waitresses, they are the women that clean the hotel rooms. These are the jobs that have evaporated. I was on a video call with the Pacific Islands, and I was told that in Samoa, of those who lost their jobs, 64% are women. Then they're being hit because they're more often in the informal economy, meaning that they're kind of invisible for help that is being distributed very often. And then on top of it, who does most of the work at home still? Even in Norway, women do more work than men. On average, women do 2.7 hours every day more at home than men do. Now, when everybody's working from home, this work at home has been increased, falls disproportionately on the shoulders of women. And then we have domestic violence, unfortunately, on the rise. And what breaks my heart more than anything else, in developing countries where schooling was interrupted or ceased to exist, boys and girls staying home. Boys are more likely to return to schools than girls. And we would see a tremendous loss of these hard-won advancements in gender equality unless we zero on the most vulnerable, on women, on young people, on low-skilled workers.
And to both of you, Melinda, you know, I want to get you to just address this. But the head of the UN's refugee agency told me recently that 50% of refugee girls, for example, won't go back to school after this pandemic ends. You have so much experience with the Gates Foundation in work in vaccinating people in vulnerable situations around the world. Your work has been prolific. Your experience is so important at this point. You've said, and I quote you here, what we know is that 25 years of increased vaccinations that have saved children's lives all over the world was set back in 25 weeks. How is that playing out? And from your experience, is this lost forever? And what do we do with this pandemic to right those wrongs?
Yes. So what we know from the Ebola, for affected countries by Ebola, is you get a shadow pandemic for women. They don't show up at the healthcare facility to deliver their babies, so more of them die in childbirth. You get interruptions in contraceptive supply chains, and so women start to have more children when they don't want to. You also get, as Kristalina said, this interruption of school. So what can you do? What did we learn from Ebola? Well, what we learned is that you can make policy decisions that affect women's lives. I'll give you an example. In Sierra Leone, for the 2 years after the Ebola pandemic went through, they suspended tuition fees. So it meant when a set of parents decided who went back to school, they didn't have to decide between their boy child and their girl child. They could put both back in school. You can do things like Ethiopia is doing, so you lose less women's lives. If a woman loses her life in childbirth, the entire family is disrupted. So what do? They make sure right now that women have clean, healthy birth kits, so if they don't show up at the health clinic, they can birth at home. India is making sure they reimburse families for private ambulance services to get women to healthcare facilities. You invest in women's health. The other thing you do is you lift women up economically. We have great data from years and years of development that if you put money in a woman's hands, she spends it on the family and everybody else. So what did India do? They put 200 million cash transfer payments right away during this pandemic into the hands of women. They had the gender disaggregated data, and they knew if you put it in the woman's hands, it will get spent properly on health, education, and jobs. And you do those things, those are just a few examples. We have many more. You actually build this quicker road to recovery.
That is fascinating. Look, I don't want to get into political responses around the world, but I do want to look at political cultural responses to this pandemic. And frankly, there's been a lot of denialism to COVID itself. And then, of course, a lot of skepticism about a vaccine. Fully half of the people where you guys are tonight in the US don't want to take it. And that's increasing. How do you overcome that? Kristalina, not just developing the vaccine, not just making it, not just distributing it, but actually getting people to believe in taking it. I want to ask you both that, because I know your experience, Melinda, is important here. But I just put that to you first, Kristalina.
Well, the International Monetary Fund concentrates on the economics of how we answer your question. And the economics is very clear. We have just calculated that if we get vaccines accelerated in terms of distribution and everybody lines up to be vaccinated as quickly as possible, we are going to generate additional $9 trillion between now and 2025. $9 trillion makes a huge difference everywhere, in rich countries and in poor countries, but it is particularly important for developing countries. We are seeing the pandemic increasing this divergence between the rich and the poor within countries and among countries. We can narrow this gap. And then we pair with epidemiologists. And this is maybe one of the unintended positive consequences of the pandemic. the IMF is integrating in our macroeconomic projections epidemiological projections. So we can show in a disaggregated manner what does it mean to do the right thing, to do the right thing in terms of protecting yourself and others, to do the right thing by going for a vaccine once a safe vaccine is available.
How concerned are you, Melinda, about the anti-vaxxers out there and the sort of cohort of people who are, it seems, infecting others with this idea that these vaccines may just not be safe for them? I mean, you've seen this before in your work in the field. How damaging is this?
Yes, disinformation causes deaths. It just does. And the truth is, I travel all over the world, or I could before. And if you talk to moms and dads who are in line at a healthcare facility and you say, why are you here? And they say, it's vaccination day. And I'll say, okay, well, how far did you come? They'll often, a woman will walk 15 kilometers in the heat. They know that vaccine saves their child's life. So I think, Becky, during these very anxiety-provoking times because of what's going on, both in terms of our health and our jobs, people are at home and they're watching this information. And so I think anxiety's up. I think that's to be expected. I think there's a lot of disinformation being spread and shared. But what I tell people is talk to your doctor. When this vaccine is available, are you going to believe something on the internet that you read from somebody who's in politics or you're, somebody who doesn't know you? Or are you going to speak to your pediatrician and your doctor and figure out if this is right for you and your family? That's where you go. And I believe once that momentum starts and people see that it is safe, they have to know their body's safe when they put it in. I think they will decide to take it so their kids can go back to school and they can go back to work.
Ladies, I've got some questions that the IMF helped bring together from our viewers. Before I get to those, and some from my colleagues at CNN, I'm delighted to say as well, I just do want to, Kristalina, have a look at a quote that you made last week. I think it was a week ago. You said, we estimate that global public debt will reach a record high of about 100% of GDP in 2020. Look, debt was already a pre-existing condition before COVID. Put a number on how high you expect it to be and what impact this debt around the world could have on an inclusive recovery.
What we got to learn very quickly in this pandemic is a very simple, straightforward lesson. Countries with strong fundamentals, prudent fiscal policies, and good buffers do better. They can withstand the shock. They're more resilient. So the very first thing is, during good times, do the right thing. But we are now where we are. We are under the pressure of this pandemic, and it is very strange for many people that the head of the IMF tells governments, please spend, support your doctors, support the vulnerable parts of your economy, keep the receipts. There has to be accountability for what you spend, but please spend. Why? Because if we stop with the economy put in for weeks in a standstill and then for many more weeks in a unstable place, then we can have catastrophic impact on the well-being of people with massive bankruptcies and massive unemployment. So today, unfortunately, countries do need to seek additional resources, and for many, that means to borrow. The good news is, though, that interest rates are record low. In some places, they're negative. You borrow and you pay less than you borrowed. What does it mean? It means that debt levels can go up, and then we have to make sure that once the economy restarts to function in a normal way, they don't go up any further. Then we start paying them down. How far they would go? Advanced economies to 125% of GDP. Emerging markets to 60% of GDP, 60, 70%. Poor countries to 50% of GDP. And you may say, hey, poor countries are doing okay. No, they're not, because the debt borrowing capacity of rich countries is very high, of poor countries very low. And already half of these countries are in a very difficult place of debt distress. So what we are doing from the fund, together with the IMF, with the World Bank, we lobbied the G20 to provide debt relief for poor countries through debt service suspension. And I'm very happy we're talking today, because the G20 just extended for 6 more months this debt service suspension for poor countries. So they don't have to choose between vaccinating their people and paying their creditors.
And let me applaud you for that. And I can see Melinda is nodding away sagely here as well. I mean, you must be delighted that the term austerity program, which is normally what we hear from the IMF, isn't playing a part in our discussion, Melinda, today. How important is what Kristalina has just outlined?
It is fundamental, because as we start to build back, we get this vaccine, we spend money on it as a global economy, we get it distributed, we get tests distributed, low cost, cheap tests. As you build that back, then if you start investing in your economy, you can invest in infrastructure. And when you invest in infrastructure, you start to get people back on their feet. And when we talk about infrastructure, it's not just things like roads and bridges. It's human capital. It's investing in people's health so that a baby grows up healthy with proper nutrition, so they can then go on to school and get a good education. You invest in education, and then they go on to get a job. And those pieces we know from country after country over time are the things that allow for people to have fully productive lives and to have then a very thriving economy.
Thank you. This is great. Fascinating conversation. I want to involve those who are watching around the world, and indeed some of my colleagues from CNN. One viewer writing in to ask, what are the implications for MENA countries? And to help you answer that question, let me start with you, Kristalina. I want to use Lebanon as a case study. Have a look and a listen to this. This is Ben Wiedemann, one of our correspondents in Beirut.
It was slow in coming, but Lebanon's coronavirus outbreak has reached its worst levels yet. This week, officials reported record increases in the number of new daily cases reported. 111 towns across the country are now under complete lockdown, and medical officials warn that hospitals are fast approaching capacity. If all this wasn't bad enough, the country was already in the throes of its worst political and economic crisis since the end of the civil war in 1990. The government is almost totally bankrupt and has warned that in the next few months it will no longer be able to subsidize basic food items, fuel and medicine, as more than 50% of the population falls below the poverty line. This dire situation was made dramatically worse by the Beirut port blast more than 2 months ago, which left hundreds of thousands of people homeless. Becky, Melinda, Kristalina?
Laying crisis upon crisis, Kristalina. This is a case study. I know Lebanon wants some cash from you. How is it going? And are there wider stories here for this region?
It is so sad to see Lebanon, a country of entrepreneurial people, very smart people, very generous people. They're hosting refugees from Syria, from the Palestinians have been there for decades, to be in such a dire situation. And why is the country there? Because of lack of political determination, unity of purpose, so there can be a pathway towards the recovery of Lebanon. We are ready day and night. If we get a call that there is a government willing and able to engage with the IMF, we know what needs to be done. Actually, the Lebanese people know what needs to be done. We need to get the financial system in shape. We need to get to audit the books of the financial institutions, including the central bank. And we have to put a credible economic plan for investors and for the creditors of Lebanon, so we can restructure Lebanon's debt. It is possible, but it takes two to tango, and we are not yet in that position to roll our sleeves and to work to help Lebanon. I am using that chance you're giving me to say again that we are ready and very willing to help Lebanon. We need a partner.
And you don't see a credible partner in anyone who is in government at present?
At the moment, it is so difficult to actually compose a government and have a clarity who is responsible for finance, who is responsible for the interactions with the IMF. As you know, the country has been struggling to just have a prime minister and have a government. And this is everybody who knows the region. I know you are very familiar with the region. It is a matter of domestic agreement. The country is fragmented, and that fragmentation is holding Lebanon back. It is actually dragging it down. We can, in my country, there is a very good saying, you can take a horse to water, cannot make the horse drink. So we can have the very best of plans, but we need to have a partner that we can do that together with. And hopefully it will come. I read, by the way, just to finish on this, that more and more Lebanese people are choosing to vote with their feet. And that is so dangerous for the future of the country. If the smart young people leave, who is going to lift up Lebanon?
No, you make a very, very good point. From the Middle East to Africa and to Melinda to South Africa with CNN's David McKenzie. Have a listen.
Here in Johannesburg, life is getting pretty much back to normal. Many predicted a catastrophe for COVID-19 across the continent. Well, it hasn't happened. Swift action by leaders, lockdowns, and wearing masks across many of the urban centers have helped slow the spread. Also, key issues like a young demographic nature of the continent has also meant that Africa hasn't been as badly hit. The WHO says that at least 80% of cases may be asymptomatic and that the infection rate is going down in many parts of the continent. I spoke to the head of the Africa CDC. He said some of those predictions of a catastrophe were really because of prejudiced notions about the continent.
Melinda, what's your assessment of the response across Africa more generally, and particularly in the north and in the west?
Well, I think one of the things that Africa did incredibly well as a continent, and of course, Africa has many different countries, but it saw what was coming. It saw what happened as this pandemic rolled across the world. And there were many lockdowns early and many messages about social distancing and masks. And so when you look at the modeling from around the world, they staved off what could have been a catastrophe. I think the other thing that's really important to remember is there's still a lot about this disease we don't know. And one of the other things we're seeing is there aren't very many tests in country after country in Africa. So we don't actually know how many deaths there have been. And so one of the things we do know, though, is what's going on with their economy. And their economies, as Kristalina said, are having a very difficult time. What does that mean then? It means that children start to go hungry. It means a pregnant mom starts to go hungry. It means that girls don't go to school because they're having to do more unpaid labor. And so We need to make sure that our response is an equitable response. We do know many of the healthcare systems have been overrun in Africa. We also know women aren't wanting to show up for childbirth, which is going to mean more maternal deaths. Those are things that just shouldn't happen. I'll give you a specific statistic. I mean, the other place we're not talking about right now is South America. Argentina, there's 83 tests per 100,000 versus in North America, 395 tests per 100,000. So we aren't actually testing to know who has the disease and how are they spreading it. And so we have to get a low-cost test out to everybody.
Yeah. We were talking to the WHO earlier on Connect the World from here in Abu Dhabi, and the idea that these numbers of reported cases might be so much higher, to the tune of something like 800 million. We have 38 million recorded cases at present. But if the numbers are as high as 800 million, then clearly there is an awful lot of work to do. Ali writes in, Kristalina, and asks, quote, how will poor indebted countries be able to pay for the vaccine? Let's get back to where we started here. Will the IMF, he says, help more than it has already done?
We do need more grants and much more concessional financing for poor countries. And we do need, on a case-by-case basis, countries where that is not sustainable, for this debt to be restructured. In other words, to be brought back to sustainability, in that the country can serve this debt. The sooner, the better. For the fund, yes, we have done more than ever in our history in these last 6 months. We have provided financial lifelines to 81 countries. And we have zeroed on the low-income countries. 47 of these 81 are low-income countries. We have been supported by our members generously with grants, so we do not ask poor countries to pay us during this time of crisis. We just extended this debt relief from the IMF for another 6 months, and if necessary, we would extend it again. And we have asked our members to give us concessional financing. They have been so generous. In April, I called for just about 18 billion. Today, we have 22 billion. And guess what? I go back and I say, please, we need more. Because for the countries that have access to markets, low interest rates, they borrow, they finance themselves. For the countries that have no access to markets, we, the Bretton Woods institutions, the fund, the World Bank, we are there for them. And I can tell you, I'm going to spend these meetings in that call for action. And I would use your question to say, people expect us to do our job for those who need us the most.
We've got about 8-9 minutes left. I do want us to just discuss where we are going and where we might get to. That's what we suggested we would do at the start of this. Melinda, what are the key lessons that we can learn from where we are at now and what we've been through over the last 9 months? What's the good, as it were, in a sense, in all of this bad?
Yes. So we're learning that global cooperation matters and that our scientific expertise that we have is there and it's coming to the fore. 20 years ago, something called the Global Alliance for Vaccines and Immunization was created. It now gets vaccines out to the farthest corners of the earth. We are so lucky to have that institution. And so now you can take all the lessons from that, or the Global Fund that deals with HIV and malaria. We can take those lessons and this new structure that has been formed, this ACT-A accelerator by country governments all over the world. When we have a vaccine, we can immediately start to deploy it out to the farthest places. When we have low-cost tests, which we are working on, we can get lots of tests out. We can get lots of personal protective gear out. That is already happening. So we have tools to bring to bear, and we have global cooperation that will make a difference. And we do know how to do that.
Melinda, then let's say, God forbid, that there is another pandemic in our lifetimes in, say, 20, 30 years' time. Are you saying that we are better prepared?
We can be. We will have to do some things, continue to do some things after this is over to make sure we're collecting data, to make sure we're prepared, to make sure that we're monitoring, to make sure we have this Center for Epidemic Preparedness extraordinarily well funded so that if something hits, we can immediately turn some faucets on to start making information flow and tools flow around the world. But make no doubt, we are seeing global cooperation amongst pharmaceutical companies, testers, scientists at a level we have never seen before. And it's why we're going to get out of this pandemic.
How optimistic are you, Kristalina? It's a tough one to ask the MD of the IMF when you are spending trillions of other people's money.
I am optimistic. I'm very optimistic. Why? 3 reasons. One, this pandemic is sobering for all of us. And we all are reflecting on what matters in life. My family matters. The fact that I can go and see them, they are on another continent, that matters. That I can help my neighbor matters. An elderly woman that I can buy food for, that matters. And I think that sobering is bringing us up. What I notice is that the goodness of people is so strong, and it comes in that kind of a challenging moment. Secondly, I'm optimistic because to get out of this crisis, we have to pour massive stimulus in the economy. And common sense is to invest in the economy of tomorrow. Green, digital, more equitable, rather than invest in the economy of yesterday. The very first stimulus were not targeting that transformation, but this new wave that is coming, we saw it in the European Union, big stimulus, green and digital. And I want to see digital everywhere. And the third reason I'm optimistic is because women are standing up. We talked about women being more at risk, but they're also strong, and they're bringing this strength to lift up everybody. My favorite saying is Eleanor Roosevelt. She says, women are like tea bags. We don't know how strong we are until we are in hot water. Well, we are in hot water and we are strong.
I always love that quote. What's the greatest lesson that you have both learnt personally through the work that you have done, but particularly of late? Melinda?
I have learned that people are fundamentally good. And much as Kristalina said, these small acts of kindness matter, and taking care of your neighbor, the grandmother who needs groceries or her prescriptions, the family who's struggling because the mom and dad do have to get on the bus and go to their job or walk to their vegetable stand. A neighbor will offer, even though they're risking their health, to care for those children. Those small acts of kindness add up. And to be honest, I see it at the global level. When we have so many calls day after day with world leaders, they're trying to do the right thing. And those acts of kindness, I know, are what is going to, for our neighbors and for the world, is what is going to help us build back more quickly. And I see it in my work over and over again.
And you do pick up the phone and talk to world leaders because, Melinda, they do pick up the phone and listen to you. What is it that you are specifically telling them? Let's leave our viewers this evening with some policy ideas and some suggestions around the world. What is your message at present?
My message to them is we have to invest in vaccines for everybody, not the highest bidder, not this bilateral deal making, multilateral deal making, because we will bring the costs down and we will get everybody covered and we will take care of the global economy and get it building back faster. And when I talk to global leaders like Angela Merkel or Prime Minister Jacinda Ardern or the head of the European Union, they are thinking about everybody else because they know that COVID anywhere is COVID everywhere. And so if they don't take care of their neighbors around them and think about everybody else, they're going to have it in their own country. And it's the only way we're going to get out of this crisis is to think about it globally, because that's how it's attacking us.
Kristalina, that is total sense. That makes total sense, except we aren't living in an era of multilateralism, of people working well together. So your final thought before we close out tonight is what to those listening around the world?
But we are actually more integrated because of the digital revolution. It may feel like the world is fragmented, but in fact, we are much more cohesive today than we were 10 years ago. And I think that when we look at the world, yes, it is multifaceted, but my experience has been that if you zero on bringing people together and you listen carefully, what is in for me? How do you structure your argument? How can you bring people together? It happens. And I would tell you the lesson I learned in this crisis is concentrate on action to make the world more resilient. We are in a more shock-prone world. Whether it's climate crisis or pandemic, we have to together build that resilience of people, of institutions, of financial systems. And to do so, we need to concentrate on those that are trailblazers, that are for positive change. Amplify their voices. The mistake we make very often is they are the naysayers and we try to convince them and we give them a lot of space. Just forget about it. Concentrate on the positive energy. And then people who are sitting on the bench and looking this way and that way, they'll go with you. So that is my main message. There are so many inspiring leaders. Amplify their voices.
With that.
And you can do that in CNN.
I absolutely will. And we spend much of our time trying to see the light in what can be a very dark world of news these days. But we do it, and we do it successfully. It's been an absolute pleasure having you both on. We must continue this discussion. I know it's going on social media. Inclusive recovery is the hashtag. As we've heard, COVID anywhere is an obstacle to recovery everywhere. That, ladies and viewers, is a fact. We are all in this together. So let's all of us help pave the way to an inclusive recovery. Thank you very much to both of you for your time tonight. And wherever you are, viewers, watching in the world, look after yourselves, look after our world, stay safe, take care. It's a very good evening from Abu Dhabi.